Nearly 7 million Americans live with Alzheimer's disease, a tragedy that's projected to grow into a $1 trillion crisis by the year 2050. While families suffer and promises of pharmaceutical breakthroughs keep coming up short, investigative journalist Charles Pillar's Doctored, based on years of investigative reporting, exposes a vast network of deceit all the way up to the FDA. Pillar uncovers evidence that hundreds of important Alzheimer's research papers are based on false information. He reveals how determined scientific renegades have fought back in service to science and the thousands of patients who've been drawn into trials to test dubious drugs. It's a shocking revelation with huge ramifications for Alzheimer's disease as well as for scientific research, funding, and oversight at large. Pillar's an investigative journalist for Science magazine, and his work has appeared in numerous publications like the LA Times, the New York Times, and the Sacramento Bee. He's the author of Gene Wars, The Failsafe Society, and Doctored, and has reported on public health, biological warfare, infectious disease outbreaks, and other topics from around the world. Charles, thanks so much for joining us on the Lean to the Left podcast, where we focus on the key social issues that we all face today.
Thank you, Bob. I appreciate being here.
Now, your book reads like a thriller, Charles, but it's all true, right?
It is indeed. It's
Yeah.
based on very careful and very carefully checked reporting.
Okay. Now, tell us about your key findings and the implications for Alzheimer's patients and healthcare at large.
The book is written as a investigative narrative, so I try to tell the story of my findings through the experiences of some key players in exposing some of the concerns raised, and also the people who are behind some of the research that I'm looking at that was identified as apparent misconduct. So the book's key findings are as follows. One is that a large amount of important research in Alzheimer's disease has shown strong evidence of having been based on doctored images. These are situations where scientists involved in experiments have changed their research images to, in many cases, suggest better support a hypothesis that they're trying to prove than has actually been proven out in the experiment. In other words, this is the kind of thing that results in false findings that can improperly steer the direction of thinking in science and even influence important drug development. So that's key to the book's findings. That's number one, is this proliferation of misconduct in research. There's also one other element that I'd like to mention that is also central to the book's analysis, and that is that for many years, a particular way of looking at the problem of Alzheimer's, this is something called the amyloid hypothesis, has dominated thinking in the field, both in research and in drug development. And this amyloid hypothesis, I can explain very briefly, involves the idea that a particular type of protein called amyloid accumulates in deposits in the brain and leads to a series of biochemical, I should say, changes in the brain that eventually causes dementia.
Right.
And the problem that has been found over and over is that remedies for Alzheimer's based on the idea of removing amyloid deposits from the brain have time and time again failed to be effective in curing the disease or even arresting its symptoms. So there's been a lot of discouragement that the amyloid hypothesis is not a correct way of looking at the disease, or at least it's only a small part of a much bigger picture of how Alzheimer's should be attacked. But the dominance of this hypothesis and the preeminence of scientists and drug companies who, for a variety of reasons, have continued to promote it as being the ascendant and most important way of looking at the disease has stalled research in other important areas that could also be fruitful in examining Alzheimer's and how to solve that problem.
Okay. Now, who are these people in this network of deceit that you talk about, and what role has the FDA played in all of this, Charles?
As listeners may know, the FDA is the regulator that examines and usually approves drugs for sale in the United States, prescription
Right,
drugs normally.
right.
And it's a very important agency. And I have to say at the outset here is that we are very fortunate in this country to have a sophisticated and usually quite effective agency like the FDA that is putting rigorous scientific evidence to the test
Mhm.
in their approval process. So I think it would be a mistake for people to conclude from reading my book or some of the other criticisms of the agency that somehow we should do away with the FDA or slash it to the bone so that it can't function effectively. What we need to do is provide better guidance and support and shake it a little bit out of its complacency and sometimes I think collusion with drug companies in the development and promotion of drugs. So let me respond directly to your question about the FDA with one example. This is a drug called Semufilum. It's an experimental drug for Alzheimer's disease developed by a company called Cassava Sciences. And for many years, as I describe in detail in my book, this drug was found to have been based on apparently fraudulent research, basic research in the lab that provided the basis for people thinking this might be an effective tool to use to fight Alzheimer's disease. Then it was found that there were numerous episodes of misrepresentation of clinical data in addition to the basic science data. In other words, when I say clinical data, I mean testing with people who took the drug in
Right.
order to see whether it was effective in
Uh-huh.
improving or slowing the symptoms of Alzheimer's disease. So you had this combination of misrepresentation of clinical data and apparent fraud associated with basic science research. In
Okay.
addition, you had numerous episodes of allegations of financial misconduct by the executives of this company that resulted in a $40 million fine from the Securities and Exchange Commission. So
Wow.
this is a wide array of irregularities associated with this one drug,
Right.
Semufilum. Now, throughout all of this, the FDA was fully informed of these problems. What did they do about it? Absolutely nothing. They let
What?
the testing go on for year after year of this drug, even though thousands of patients were being given this drug for which there were so many grave questions about its safety, efficacy, and I might add, the circumstances under which it was introduced and it was presented to the public
Okay.
and to shareholders. I would just say, just to clarify, there were questions about safety, but there was no clear evidence that it was uh, the cause of serious harmful effects. So I just want to make that clear. That
Yeah.
said, it was a situation where thousands of patients, Alzheimer's patients, were taking the drug and were unable to try other experimental remedies as a result. And finally, the drug's trials were ended just very recently in the late fall because the company finally concluded that the drug didn't work. Throughout all of this, the FDA had the power to step in, but they never stepped in. This, I think, was a failing of the agency's oversight powers.
Is this all about greed? What's going on here that you're talking about?
I think it's a combination of things, Bob. Certainly, there's enormous money to be made in situations like the Semufilum situation. So
Uh,
even though the drug ended up being a failure, and the company itself is now, its future is very uncertain because its stock dropped by 90% or 85% the
sheesh.
day they announced the trial failed. But even though the company may have seen its last hurrah, you have a situation where many shareholders, including executives, over the years profited greatly from the rise and fall of that stock. So, yes, I think, in my opinion, greed plays an important role. It also
Mhm.
plays an important role in the development of other drugs that have had either zero or very minimal effectiveness in fighting Alzheimer's. But it's not just greed, it's also the important academic considerations associated with papers that I have found throughout the course of my research have been based on either misconduct or apparent misconduct. What is the motivation for this? Often it's professional standing, prestige, career advancement, and grants from companies and from the government. If you can show apparent success, even though it might be based on image manipulation, it can often, when it's not caught, which is a lot of the time, people can have incredible careers that are based on false information.
Incredible. Are there other drugs? You mentioned this one drug. Are there other drugs that fall into the same bucket of falsehood and so on?
I think the Semufilum example is a primary one because it's so vivid. But what we have is a situation where there have been a lot of drugs for which there is now clear suspicion about their development associated with apparent misconduct in the research that led up to them. Let me
Yeah.
give you an example. This is actually, it's detailed in the book, but it's also something I wrote in a expose in Science magazine in the fall of last year. That would be the fall of 2020. And this situation involved one of the most important Alzheimer's scientists in the country, a guy by the name of Eliezer Maslia, who at the time was the chief of neuroscience division of the National Institute on Aging. Now, this is the agency within the National Institutes of Health, which is the federal government's primary funder for biomedical research, and a very important agency that has, in my opinion, been one of the most important and greatest sources of knowledge and science for many years. So when I say that agency has lapsed in certain ways, and they most certainly have, I want to emphasize that I'm not suggesting that the entire agency is useless or has done harm to our body of knowledge. In general, NIH has done a terrific job in many of their areas of study and their areas of funding. But in this case, there was a lapse that was monumental. And let me explain what it was.
Okay.
So in the course of this investigation I did of this guy, Maslia, what I learned, and this was working in conjunction with experts in forensic image analysis who reviewed hundreds of his papers. This is a guy who had been illustrious for having been a prolific investigator who wrote more than 800 scientific papers on Alzheimer's and also Parkinson's disease, and was one of the most respected people in the world in those fields. When he was hired by NIH in 2016 to be the leader of the neuroscience division of the National Institute on Aging, and I might add that this is a division that has a multi-billion-dollar budget for funding neuroscience research, much of it in Alzheimer's disease. People really applauded this appointment because of his reputation and his standing in the field. But what I found was that 132 of his papers, and this is not a review of all 800, but a pretty good review of a lot of his papers, 132 were found to have been based in whole or in part on doctored images, according to a forensic analysis by several leading experts in this realm and validated by some of the top names in neuroscience in the world. So what happened is that the day my article appeared, Maslia was removed from his job as the leader of that division. Now, that's a good outcome in the sense that he was removed, but what could possibly have led to someone with a history of such amazing and horrifying degree of apparent falsification of research being the leader of this effort? I think it was complacency and just a kind of complete breakdown in quality control of hiring at NIH.
Okay. All right. So has all of this, have patients been harmed as a result of this? They've been drawn into these drug trials, and these folks are, and their caregivers, they're desperate for help, desperate. And to think that they're being drawn into experimenting on drugs that like this that are ineffective. What's the impact on these patients?
I think, let me answer your question in two ways. In the immediate sense, for drugs that are actually in this clinical testing, such as the one I mentioned from Cassava Sciences, the impact is severe. Of course, the human impact, the horrifying disappointment of the people who are enrolled in these clinical experiments and their family members and caregivers. Of course, the human cost is great, not just because of the disappointment and the deep worry that people feel about the progression of Alzheimer's, but also because when they're in this trial, they're not allowed to be trying other remedies for Alzheimer's, other experimental remedies for which there may be greater promise. And as a result, they're foreclosing their ability to be involved in testing that could eventually become more effective or be more helpful to them in their care. So that's harm number one.
Okay.
The other harm is that when you have a situation like Mosley from the NIA that I mentioned a few minutes ago, he was involved in the development of numerous drugs for Alzheimer's and Parkinson's, and the development of hundreds of patents for drug development. So what you're talking about is loading up the pipeline for eventual or actual drug development with dubious science behind it. That raises deep questions about whether enormous sums of public and private money is being wasted. And if it is, what you have is the enormous costs of opportunities to develop remedies or approaches for treating Alzheimer's that are basically sitting by the wayside for lack of funding. And what I've said earlier is that because of the dominance of some of the thinking by big names in the field associated with the so-called amyloid hypothesis, some other potential approaches to curing Alzheimer's, or at least making its symptoms less or improving the quality of life for Alzheimer's patients, have been left at the wayside.
Yeah, I was just going to ask you if all of this has actually set back effective treatment for Alzheimer's disease. And what you're saying is, yeah, it probably has, right?
I think so. I think we have to look at it realistically. Alzheimer's is an incredibly difficult problem to solve because of the complexity of the human brain. And by comparison, some of the diseases and chronic illnesses that human beings have faced have had, particularly diseases of aging, have seen a lot of success in recent decades. Cancer, diabetes, heart disease, stroke, all of these are conditions that are incredibly important problems of aging, and really in many cases of younger people as well. And but we've seen a lot of success with a variety of treatments, genetic treatments, radiation, drugs, and healthy lifestyle changes, all kinds of things that have been able to greatly reduce the rate of death for some of these conditions. Not so with Alzheimer's. As we have had success in treating other illnesses, we have an aging population. We have more and more people living to the age where Alzheimer's is more common.
Yeah.
And as a result, we've seen increasing deaths from Alzheimer's, and increasing tragedy associated with the loss of loved ones and their cognitive abilities. It's a very tough disease. That said, yes, I think a greater diversity of research into realms that have been foreclosed by the concentration of research in a few areas might have served the population of patients and their families much better in the long run, even though, again, there's no guarantees in this. It's a tough area, and we need more research to explore those other methods.
Has your research caused you to feel like there are some hopeful signs or some drugs out there that may actually be helpful? Hey guys, I'm Bob Gaddy, founder and host of Lean to the Left. I'm excited to share our new book, Hijack Nation, Donald Trump's Attack on America's Greatness, co-authored with political analyst and professor C.J. Waldron. In Hijack Nation, we delve into the unfolding story of America's political landscape through a series of essays from leantotheleft.net. We explore how Donald Trump's presidency has transformed American politics, challenging our values and institutions. Hijack Nation isn't just a book, it's a call to action. It invites you to reflect on what it means to be American in a divided political landscape. Together, we can reclaim our nation's greatness. So get your copy of Hijack Nation today. Visit leantotheleft.net and click on the Books tab to learn more and to order.
Yeah, I think it's too soon to say about new drugs that might be hopeful or possible to cure the disease in the future. But what we can say is that there are some interesting and underexplored areas of research that could move the needle on Alzheimer's, on our understanding of it, and lead to better drug development. Let me name you a couple of those that I think are quite interesting. One is the idea that infections may be associated with Alzheimer's, and you could call it the infection hypothesis of the disease, that it might cause a kind of inflammation in the brain that could lead to all kinds of bad cognitive effects over time. There are a lot of people who believe that infections may be a cause of it. There's clinical trials going on with treatments for infections that maybe even latent infections that have been perhaps living in the brain for a long time, and their effects have not been well understood. These are the kinds of things that I think give some scientists hope for alternatives that could move the needle on Alzheimer's over time. Another element of it is this idea that inflammation is itself something that could be treated in the brain that could also have an effect on the disease. And finally, I want to make mention of one of the central characters in my book is a guy by the name of Matthew Schrag, who is a neuroscientist at Vanderbilt University. And all of his work associated with scientific integrity, and this is work that he and I have been discussing for years now. All of that was done, I have to point out, separate and apart from his work as a university professor at Vanderbilt. But his work is in part a fascinating look at these structures in the brain called lysosomes. And these are, you might say, the garbage collection units of the brain where they process waste products such as proteins that tend to accumulate in neurodegenerative diseases and render those more safe for the brain. And what Schrag thinks might be a fruitful way of looking at this is whether these diseases, not just Alzheimer's, but other diseases of cognition as well, might be a result of these lysosomes not working at their best. And perhaps it's a disease that could be attacked by improving the performance of how these lysosomes work and do their waste collection in the brain so that people's cognition does not degrade in the way that it does in Alzheimer's and other diseases.
That's interesting. Now, is he one of the scientific renegades that are fighting back that were mentioned earlier?
Absolutely. And I should say, I don't know, obviously you have a diverse listener audience for this podcast. And some people are probably quite sophisticated in their scientific knowledge, while others are focused on other issues.
Sure.
And I just want to say that my book is written as a narrative investigation. So it basically tries to look at these problems, which are scientific issues, through the eyes of people in their lived experience, both people like Matthew Schrag, who is a central character, and his exploration and his discovery of these misconduct issues is a big, important part of the book, but also through the eyes and through the experiences of people who either engaged in apparent misconduct or who were caught up in it through perhaps not their own actions, but through their relationships with scientists who were found later to have engaged in improper actions. And the reason why I did it that way is that this book is meant to be accessible not just to scientists and experts, but to anyone who has a family member who might be an Alzheimer's patient, or to people who are concerned about the disease and the way in which the regulatory world and the funders and the scientists who engage in this sort of work are handling it, and to understand it from the perspective of a story through the eyes of those who are living these experiences.
Okay. In your view, what needs to happen at the FDA, the CDC, the NIH, and other healthcare agencies to get us back on the right track and maybe even find a cure for Alzheimer's?
Thank you for that question, Bob. I think it's very important that we look at this from two perspectives. One is that these are agencies that are critical to our healthcare quality in the United States. And I believe that on the whole, they have done excellent jobs in a lot of their work. I think a kind of complacency and laziness and arrogance has set in certain ways. And your podcast is called Lean to the Left, and you know that these agencies have received an enormous amount of criticism from the right in recent years. But I think people on the left should understand that if the left does not also see where the weaknesses are, and in a sense raise concerns about the performance of federal agencies from a position of understanding their important role and supporting their basic functions, then they will be criticized from the right in ways that are perhaps not as good for the American public and might be oriented on tearing them down rather than making them more effective. So I just want to make it clear that's the perspective that I have and the concern that I have. But I would just say there are a few things that should and must be done to make these agencies more effective. One, they need to be shaken out of their complacency that this is not a big problem, that scientific misconduct is not a big problem, not just in Alzheimer's research, but in other medical fields as well. Wow. Second, they need to devote time and resources to ensuring that grants that are given and that drug applications that are reviewed are not based on misconduct, and that they should install the correct experts and software to do the kinds of examinations that would expose these things in a way that they have failed to do up till now. And third, they need to be given the budget and the personnel to go after apparent misconduct and to investigate it in ways that are effective. Right now, one of the main things the federal government does when it hears about possible misconduct is it kicks the investigation back to universities, where the home university of the accused investigator is. And the problem with this is that universities have themselves been complacent, sluggish, and ineffective in many of their investigations. And the reason is pretty apparent. When one of their investigators, particularly a high prestige investigator, is accused of or evidence is found to suggest misconduct or inappropriate research by one of their investigators, they have the most to lose and the least to gain from a timely public exposure of their work to look into that apparent problem. And consequently, because there is no independent investigation of these things, you have these universities, which have not been doing a great job by and large, being responsible for it. So I think we need reform in who investigates it, in how independent the investigations are. And we need the federal government to invest more in policing this area. So that's a critical thing. The third leg of the stool, which I think is very important, is journals. These are academic journals that are the gatekeepers for deciding what science is important enough to put before the scientific community. And their decisions have important bearing on the directions of the field. So when they don't do a good job in examining whether scientific images are well constructed, thought through, and that they're not based on apparent doctoring that could change the conclusions of an experiment, they are doing a grave disservice to the scientific community and to the public, because a lot of this leads to basic directions in scientific research and also into the development of drugs that are associated with those research projects. So those are the three things: federal agencies, universities, and the third being journals. All three need to become more diligent, more determined to look at these important issues and to do a better job and to devote the time and resources to do so.
Incredible. Now, it seems to me that by the agencies kicking these investigations back to the universities. It's putting the fox in charge of the chicken coop, isn't it?
I would agree completely, Bob. I'm
Yeah.
afraid that we've seen over and over again that there is secrecy, complacency, and a lack of follow through, even when terrible things are discovered in some of these investigations, they don't see the light of day.
Yeah. Okay. Now, what are your thoughts about effective Alzheimer's research moving forward under the new Trump administration?
I think right now we'll just have to wait and see, but I'm deeply concerned that the Trump administration might take a capricious and not well-reasoned meat axe to some of the most important programs of research that are being funded by the federal government. Let me reiterate that I have been very concerned about the performance of some of the federal agencies on the matters that I've written about, but
Right.
I deeply support a lot of the research funding that they're making and the directions they've selected. Some of these are excellent and very important, and I'm fearful that by putting people in charge who don't have a clear-eyed and thoughtful, scientifically well-founded approach, that things may degenerate dramatically under the Trump administration. So I think that's something that we're going to look to the people in Congress and people in the academic world to try to fight hard to preserve important parts of those research portfolios.
It seems to me that we're in a tough spot. Trump wants to put RFK Jr. In there as Secretary of Health and Human Services. Um, he has no scientific background, and he's talking about he's against vaccinations and so on. And it just seems to me that's the opposite of what needs to happen. Do you agree with that?
I agree that a lot of what RFK Jr. has been saying is not well founded
Yeah,
in scientifically and could be very dangerous, if not disastrous, if well implemented by the federal government. That said, there's a few things that are hard to argue with that he
yeah.
says, in
Okay,
cleaning up the food supply,
sure.
being more cognizant of the importance of eating healthfully and preserving our ability to monitor the food industry and the drug industry. Those are things that are important for anyone who's administering these programs.
Sure.
That said, I am deeply worried about other things that he might do, and I think they could be very harmful.
Yeah. Okay. Now, I have one last question for you, Charles. You've done all this work. You've written these books. You must have people pissed off. Are you afraid of any kind of retaliation? Have you had any threats? Have you felt in danger in any way?
So I've been an investigative reporter for a long time, and I've done a lot of different kinds of reporting. Years ago, I spent a few years reporting on racist violence in prisons against inmates of color.
Okay.
And those, in some ways, I felt a little bit more threatened then when you're writing about terrible activities by people holding guns. It
Yeah.
gives you pause sometimes.
Yeah, it does.
But in this case, of course, I've been attacked online by the people whose vested interests have been threatened by some of the things I've written. I think
Sure.
the bigger threats honestly, have been legal threats. And I'm happy to say that I have not been sued over the many articles I've written about this, even though they have had dramatic impact on drugs and on people's careers. People I'm talking about are people
Mhm.
who have been found to engage in apparent widespread misconduct in their work. I have never actually been sued, even though I've been threatened many times. And that's because when I do my work, unlike some of these scientists, I check, double check, and triple check everything to ensure that I'm being both correct and also fair minded. Remember, the job of a journalist is to unearth these facts and this information, but also to give the person I'm writing about not just an opportunity to respond to the concern raised, but also full knowledge of everything that's going to be in the article before it's published so that they have a completely fair and complete ability to judge what's in there and how it might affect them and how they might respond. And I am happy to report that in every case, including every case that I write about in the book, this is the practice that I've followed.
Excellent. All right. So where can people find your book, Charles?
This book is available on everywhere. I certainly encourage people to buy it from their local bookseller. You can also buy it from Amazon, Barnes and Noble, and all the other large internet resellers. And of course, you can find information about it at all of those places and at my publisher's website. That's Simon & Schuster.
Okay, excellent. And for you guys watching and listening, just know that if you check the show notes or the introduction to this episode, I'll have a Amazon link in there for you that you can just click on and obtain the book too. So thank you, Charles. Is there anything else you'd like to add? This has been a fascinating discussion. I'm surprised that you haven't, somebody hasn't called you up and said, "Hey, buddy, you better stop this or you're done."
I laugh, but yes, of course. I sometimes worry a little bit, but I'm fortunate and I think I'm going to be fine. But thank you for your concern. Thank you so much, Bob, for your interest, and thanks for taking the time to explore this subject with me.
Absolutely. It's a very important topic. If you haven't experienced what it's like to be dealing with caring for someone with this, you need to pay attention. Hey guys, I'm Bob Gaddy, founder and host of Lean to the Left. I'm excited to share our new book, Hijacked Nation, Donald Trump's Attack on America's Greatness, co-authored with political analyst and professor C.J. Waldron. In Hijacked Nation, we delve into the unfolding story of America's political landscape through a series of essays from leantotheleft.net. We explore how Donald Trump's presidency has transformed American politics, challenging our values and institutions. Hijacked Nation isn't just a book, it's a call to action. It invites you to reflect on what it means to be American in a divided political landscape. Together we can reclaim our nation's greatness. So get your copy of Hijacked Nation today. Visit leantotheleft.net and click on the Books tab to learn more and to order.